Hi, I'm Dr. Raghu Athre with ATHRÉ Facial Plastics in Houston, Texas. I am a double board certified facial plastic surgeon specializing in facial rejuvenation. So one of the techniques that I use a lot of in my facial rejuvenation procedures is fat transfer. I've made a lot of videos about it, and it's kind of a very key critical component in a lot of my facial rejuvenation procedures. Hence, I get a lot of questions about it. So some of the most common questions are, one, where do I get the fat from and how long it lasts? So this video is going to dive a little bit into that and kind of give you some information about fat transfer. So there are a couple of areas that I really like to find fat, okay? So the most common areas are the anterior abdomen, okay? The area that's right below the belt line and above the pubis, that's the second area, the flanks, and the inner thighs. So these are the most common areas that I harvest fat from. So whenever I tell a patient that I'm going to be doing fat transfer, the first comment they usually say is, come on, please take it all. Do as much as you can, okay? So let's kind of be realistic in how much fat we're taking. So I'm sure many of you have seen TV shows and YouTube videos about a guy in there who's sucking for hours and shows mountains of fat coming out in the tubes. That's really not what we're doing. We use a very, very small cannula, which is about 2 millimeters in diameter. And these things are very important because these little changes in technique are how we get our results. So the amount of fat we're actually taking out is only about 40 or 50 cc's. That translates to about 8 to 10 teaspoons of fat. So it's actually a very small amount. Now, many of my patients have had other plastic surgery procedures before. So if they've had liposuction or a tummy tuck or something to that effect, that anterior abdomen may not be a good harvest site because there's going to be scar tissue in that area. Also, patients who've done a 360-degree lift or have had liposuction of their flanks, again, not a good area to go into an area where liposuction or a prior surgical procedure has been done. Therefore, this is why I like to have multiple areas, so abdomen, pubis, flanks, as well as inner thigh. Between one of those 4 areas, we're going to find the amount of fat that we need in order to do the procedure that we need to do. Which takes us to the second part of this question, how long does it last? Well, part of the reason that I'm picking fat from these areas preferentially is because of the long-term effect of how the fat lasts. Fat in these areas tends to last longer. So what is that number? Well, this is not a simple yes-no number type of explanation. So the fat technically is permanent. So if I, for example, take 30 cc's of fat out and spin it down and all that, I'm probably going to get about 25 cc's of pure fat. Now, that pure fat, when I inject the fat, I'm injecting it in micronized portions. So I make the fat into smaller particles so I can inject it with a needle. So that fat, if we could radio label it, like put little tagged radio indicators and measure radioactivity over a period of time, you would see that that fat is actually living forever. However, we continue to lose volume as well. So if we really look at it, the better question is about how long before a patient needs a secondary fat transfer procedure again. That number is about 7 to 8 years. So it doesn't mean that the original fat died, only means that the patient continued to lose volume to a point where it was noticeable and you want to add some more volume. There's a little caveat that I want to add to this. Since we know that the fat is permanent and the fact that a lot of it is living using the techniques we do not overfill patients. So older fat transfer techniques would recommend overfilling the patient, which means, so you would kind of go, that looks about right, and I'm going to add another 15 or 20% to compensate for any volume changes. The techniques we use, you don't want to do that, because if you overfill by 15 or 20% and that 15 and 20% lives, you're going to be overfilled. So you want to correct only to 100 100% of the defect, let everything heal, and if we need to do more, we can do more. It sounds like a little bit more work, but it's definitely the safer way to go when you're doing micro and nano fat transfer. So I hope this video has given you a little insight about how fat transfer works and some of the most common questions we get about fat transfer. If you have more questions, please hit us up, DMs, comments, email, phone, however you'd like to do it. If you like this video, please give us a like or subscribe. It gives us a little bit of feedback and insight into what types of videos we should continue making. So thank you very much for your attention. Dr. Raghu Athre, ATHRÉ Facial Plastics, Houston, Texas.